1,052, and further up from 2 weeks ago, which was the average was 1,064. Sadly, we're also reporting an additional 40 deaths since Monday's update. And the 7-day average for deaths has increased by 1, up to 13, whereas last week it was an average of 12. And of course, our condolences go to the family members who have lost loved ones in this matter. The number of patients in hospital and ICU have been showing increases, with 730 people currently hospitalized and 204 of which are in ICU. The testing results, today we did 58,560 tests. Were processed yesterday, and the positivity rate was 3.1%. Our 7-day average for percent positivity is 3.3%, which was up from 2.8% this time last week, and further more than up from 2.5% 2 weeks ago. So you're seeing the steady increase over the last number of weeks that we were concerned about, and that, of course, from our modeling table, we're predicting that we would anticipate as we saw things changing with the variants of concern, which I'll give you an update on now. There are now 1,218 confirmed cases of variants of concern in Ontario. 1,136 are of the so-called UK variant B1.1.7. And we have 47 are of the B135, or the so-called South African variant, and 35 of the P1, the Brazilian variant. There are an additional 10,291 samples that have screened positive for the mutation, where no lineage has yet been determined because the sequencing has not been done. So our 7-day rolling average for the variants of concern is 41.4%. 1 week ago, it was 32.6%. That's significantly up. The latest effective reproduction number for the variants of concern is 1.35, as that's compared to our none variants of concern rate, which is at 0.9. So you can see one is waning, the other is escalating. So where does that leave us? We have been watching steadily these numbers, and we know that we're concerned in this precarious position. As we are watching the variants, the older one, wane and go down, the number of variants percent-wise and in numbers actually are going up. And we knew this was going to be predicted by the modeling. The question is, how fast is it going up? And through our different measures that we're undertaking, can we slow the rise, getting away from the so-called hockey stick or exponential growth that we had seen in some other jurisdictions, and so that while we are entering a third wave, the question is, what type of wave will it be? Is it an undulating wave? Is it a rapidly rising, breaking wave? Use the analogy. Is it going to look like wave 2? We don't know right now. And certainly the time that they were saying was the doubling of the numbers was going to be happening every 7 to 10 days. We have not seen that. So I think we are having some effect on slowing the rise of the variants of concern in Ontario. Nevertheless, it is rising. And so we have to be extra cautious in the weeks ahead. And that means while we do have some parts that we have affected the framework, some have gone into higher levels of control, some have eased up a bit. But as I said before, it doesn't matter which level of the framework you're in, whether you're in the gray lockdown or in the green or any color in between. The key message is that personally, you need to keep doing what you need to do. Because someone with a variant of concern, unbeknownst to you, could show up in your area, even in a green area, because there's still people moving around the province. And it doesn't take much of a contact with that person to result in an outbreak, as we have seen in some areas that had been quiescent or very little activity for quite a while, all of a sudden implode with a number of cases fairly quickly. And those are true with the variants of concern especially. So our measures are very important at this time. The personal measures are extremely important. As we move into warmer weather and spring weather, as people want to go out and around, we encourage you to get out and around. But again, you do your personal measures to protect yourself in those events. And if you're out walking, exercising, or etc., that you are wearing your mask. If you're in close contact or you think you might come into contact with people, even if you're out jogging and running, you carry it in your pocket, you may get into a crowd which you didn't anticipate. And you need to wear that during that time and keep your distance if you can at all times. So the next couple of months are going to be very critical. As we roll out the vaccine, as we're getting well over 1.3 million doses have been in arms up till now and progressing steadily each day. As we look at many different areas and venues to roll it out and to get it out as quickly as we get it to people who need it and to improve our overall community immunity beyond what we have already affected within our long-term care and our retirement homes as we complete the task of doing our residents. And we would like to make sure we get all our staff in those areas as well as our essential visitors, caregivers, done as we can see already the great impact it has had on reducing our cases in those centers, our deaths in those centers, and outbreaks in those centers. So we've seen its effectiveness. We know that it can be effective as we roll it out across the province, and we are eagerly asking for as much vaccine as we can get so we can move on it as quickly as we can because we have the system in place to do so. And so with that, I'm going to hand things over to the media unless Dr. Heyer has any questions at this stage. So I'll hand over to the media for questions. So thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Colin DeMello with CTV. Please go ahead.
Hi, good afternoon, Dr. Williams. So I wanted to ask about the third wave. You seem to be signaling a lot of concern about the escalation, that hockey stick type pattern that we're seeing. I'm wondering, in your view, are there going to be any mitigation efforts beyond what we have in place, beyond the color-coded framework? Do you see anything else that's necessary to do now to bring down those numbers?
Well, thank you, Colin. And while I'm saying that we are seeing, and we've seen in some other jurisdictions internationally where they have experienced a third wave, but not like a hockey stick, but more of a gradual one. So with places and measures in place, they've been able to bend the curve, if you may, slow that down from a hockey stick to a slope. Right now, it looks like we are doing it. I'm not going to be complacent saying we've got it done. Let's be very careful on that. We are continually moving some of our areas up in the framework as we move them from colors of green and yellow to orange up to red. And as you noticed last week, we did some to the gray lockdown. And we moved Ottawa early this morning quickly up into the red zone with the data information because we're trying to be as nimble and as quick as we can to respond and put those aspects in place to curtail the spread of the variants of concern as much as we can with our current measures and our lockdown as we see fit and need to, and move on it as expeditiously as we can in order to keep the slope down in that. But we are in the third wave. It's just a matter of what kind of wave is it or will it be.
Follow-up?
And so at what point do you make that decision that we would need some additional measures to get the numbers down? Because we're seeing those numbers kind of rise up to levels that, we saw in January. There are some calls from Dr. Peter Uni with the Science Advisory Table as an example for a 3-week lockdown in parts of the Golden Horseshoe. Do you feel like that's necessary at this stage?
Well, our numbers aren't anywhere near the second wave that we had before. We are still down, as I've said, we just read the numbers out there. We're about 3 weeks ago, we were around the 1,000 to 1,100 mark average. Then a week ago, we were at 12 to 13. This week, we're at 13 to 14 or 15. Remember, in the peak of the second wave, we were up at 3,000. We actually touched over 4,000. So we haven't got there yet. And we're seeing some that have gone up with some cases and come back down again. Our health units are working hard at the case contact management. Our performance as far as doing that has been better than we did with our classical or the old style of variants of concern. But we are watching the situation. So we're utilizing to the max our framework. and to move quickly on containment measures as fast as we can to limit those outbreaks. And we have had some situational outbreaks in workplaces, some in congregate settings, and some in university settings and school settings too. But we have kept those down so far. But we're going to have to be really attentive to this over the next number of weeks.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just in terms of moving Ottawa to the red today, and I don't mean this to just be specific to Ottawa, but cases there have pretty much doubled in a week, and the wastewater thing is indicating it could be getting worse. So in situations like that, is moving up just from one level to another, like is moving to red, is that really going to do much difference? People can still get haircuts. People can, still go to restaurants, I believe. How much difference is this really going to make?
Well, we had discussions with Dr. Etches, and certainly when you move from the orange to the red, you get a decrease in the number of people can be in indoor dining. Congregate numbers are down. Gatherings in certain locations are down as well. So there's a number of things that do kick in and are effective in the red zone. As well, looking at the data and information that they're concerned about, they just moved into the red zone, but as you noted, they saw their cases increasing and VOC outbreaks in some settings that they were noticing, including people being less than stringent on their adherence to the standards. And they have a history of having had the wastewater mapping over time, and they've seen before. It usually precedes it by a week or two. So they have had a historical experience with it some other jurisdictions haven't had. So we're being, I would say, preemptive and trying to get it under control. If it doesn't adequately deal with it, then Dr. Etches and we'll be in discussion further if we need to take further steps to increase it. But so far, she seems to be satisfied that she can do it with that. And if she needs to put some Section 22s in some areas of certain high concern, she would do so.
Follow up.
All right, thank you for that. And just turning to the local situation, so you've been talking with Dr. Davila and Dr. Lowe about maybe carving out a few things, some special exemptions for Toronto. What do you think is appropriate to do here, given the higher level of cases? And for example, there are a lot of people talking about, would you allow barbershops and hair salons to cut hair outdoors, because no one in Toronto has had a legal haircut since the middle of November?
Well, we know there is a lot of aspects because unlike some other areas, Toronto and Peel have been in this lockdown mode, as you say, Rob, since November. And we know and we sense that. And so we're trying to look at is what can we, in consultation with Doctors Davila and Lowe, and with their numbers having edging up, and their numbers have edged up over the last number of weeks like the rest of the province. So that is concerning. Their variants of concern have been coming up, not escalating as rapidly as some others, so that's reassuring, but not totally being complacent on the matter. So we're asking ourselves and having discussions with them, what can we do to work with them and work with the citizens of Toronto and Peel to stay at the task, stay in control, because these are our areas of Ontario that have the highest population density in there, and we have our highest rates in cases. So we want to have that ongoing consultation with them, and then in giving advice then up to the minister as well as to the premier and cabinet accordingly. So we're in discussions at this time, and we hope to be able to come up with some thoughts and ideas of how we might be able to help everybody stay at the task, keeping this third wave under control, because we really don't want to see it take off in Toronto and Peel.
Next question.
Your next question comes from Anthony Fury with Post Media. Please go ahead.
Hi, Dr. Williams. Thanks for taking my question. I'd like to ask you about a study that's been in a bunch of media stories the past day or two from Hamilton's McMaster Children's Hospital, and how they found that youth suicide attempts have tripled because of COVID-19 restrictions just at their hospital alone, likening it to COVID-related social interaction problems, increased conflict at home, increased substance use. When you look at this data, does this perhaps factor into when you're revising restrictions whether or not you feel they need to tighten for adults, maybe easing them for youth. I know you've spoken about youth sports before. How does this factor into the decision-making process?
I haven't actually read that specific article in detail. It's very similar to ones we've received from other pediatric consultants and our centers on that. That's why we have been so adamant that we want to keep our schools open. We've known that there has been the consequence of this, not just in this particular area, that you've alluded to, other developmental issues, eating disorders, a number of factors that pediatric consultants have been concerned about, as have parents and that. So we know it is a challenging time. And we have to be cognizant of that. I think what you've raised is that while we want to keep cases down and ICU numbers down and deaths related to COVID down, there's other aspects around the outside that are being impacted just as much. And that's why we're trying to get our surgical wait times down. We're trying to get caught up on those urgent surgeries related to cancer and other things. We don't want those delayed. And that's why some people say, well, your IC numbers are up, but they're not that bad. And yet, at the same time, we know we have to get those down. So that's that aspect. But even related to what you're alluding to, how do we address those issues and what do we need to be aware of as we go through this? And that's why we're pushing hard towards the vaccination. It opens up more than just things in the framework. It opens up access to other social and connectivity and issues that are critical for these individuals who are needing that type of removal of isolation and limitations. So it is a pressure I feel to continue driving at that. And I think Dr. Heyer would like to have a comment on that as well. So over to you, Dr. Heyer.
Thanks, Dr. Williams. Good afternoon, everybody. I think this is one example. Again, haven't read the study, but certainly have heard some similar descriptions. I think it's also important to remember that there are many very challenging outcomes and very sad things that are occurring. If we look at the opioid-related deaths that have occurred over the period of time during the pandemic, we're seeing a significant increase, over 50% increase year over the year prior and during the period of time of the pandemic. So it speaks so strongly to why we need to continue to do everything that we can to move out of this pandemic so that we can get back to the situation where we can provide care, we can provide support, we can provide everything that we can as a society to each other to move past. Clearly, there's many different aspects that are important to consider when we're doing the work. Dr. Williams has led so many of those aspects, working together with others in the government and cabinet, and really recognizing the importance of moving forward to reduce these cases in any way we possibly can, but also then moving to continue to eliminate and move away from having continued transmission, continued infection, continued hospitalization, and all of the terrible things that occur associated with the pandemic, both because of the illness and because of the steps that we have to take.
Follow up?
Thanks for that. Dr. Williams, in relation to that, though, we know that British Columbia, for example, has allowed restaurants and businesses to stay open throughout almost the entirety of the pandemic response. They haven't shut down kids' sports the way Ontario has. They've never gone into stay-at-home measures the same way we have here, and yet they have lower per capita case rates and death rates compared to Ontario. Have you been looking at what Dr. Bonnie Henry's been doing in BC and looking at implementing a similar approach there?
Well, we meet on a regular basis with the Special Advisory Committee, all the Chief Medical Officers of Health, and we compare issues across the country, knowing that one of the things that's unique about Canada is with a federated system, we have a large variety of different sizes. The same is that some things that BC might do, Quebec will not be doing, and some things that BC is not doing or is doing that PEI wouldn't do. And so we know we have places of very much different size, different risk factors, different issues that they have to address. And we know that the smaller ones haven't had as many cases as we have. They haven't got the same concentration of density, the same movement in and out of the population and risk factors accordingly. So it's very hard to do the comparisons of how they equal. It's the same as we have some parts of the province with our framework that haven't got the same restrictions as others. And we know that some of our populations that are more rural, more dispersed than that, like larger parts of British Columbia are, and some of our maritime areas, that's an advantage because it's not as concentrated as closely and the distancing can be done. And that's a good thing to have. And they benefit from that kind of thing, same as our smaller, our rural and remote areas have less overall numbers, except when we have outbreaks, as in Thunder Bay at the moment. So we find we don't compare Toronto to Northern Ontario in particular, because it's quite different. And what works in one may not be as effective in another, and that's why we have our framework. But the same as we have a different type of approach across the country, we do some things very similar. We look at what each has done successfully and areas that we might use that may be appropriate in our areas. Some things may not be appropriate in our areas. And so as we talked about, I remember a week ago when we had the anniversary of the event, and we talked about it as a marathon. I said, yes, it's been a marathon, but for us, it's like a marathon holding hands. And we try to do it together as a cooperative in that, recognize that some of us run faster, some run a bit different, and we have different pace, but we always help each other along in that way and support. So my answer is that some things may work and some things don't, and we have to recognize our risk factors and the differences between us and support each other as best we can.
Last question.
Your final question comes from Cynthia Mulligan with City News. Please go ahead.
Hello, Doctor. I'm just wondering if you can talk about long-term care residents. You know, we know that the vast majority have had 2 vaccines so far. Why have restrictions not been eased? Why can't they just go outside for a walk, those who can?
Well, thank you. And we have nearly completed, there's a couple still outstanding little ones to get the vaccines in our residents in the long-term care. Let's just stay with long-term care at the moment, not retirement homes. But we still have some staffing to get done. And we're trying to pick that percentage up and get that covered, as well as all the essential caregivers. And we are starting to have meetings and discussions with the Ministry of Long-Term Care and saying, now in a vaccinated COVID entity, what should we ease off on? What should we do? And we're really looking to have those discussions with the Ministry of Long-Term Care and with the Minister of Long-Term Care to say on a go-forward basis now what should be allowed, what could be allowed. And that would apply also to our seniors ministry working with the retirement home sector when we get that one all completed as well, because a lot of them have the capacity then to have a social gathering like together if they're all vaccinated, and that's some of them have been in their rooms for a long time, and we like to look at whatever we can because it is their homes. That's long-term care home. It's retirement home. That is their residence. And how do we do that in a way that's safe so we don't have outbreaks back again? I think we're ready for those discussions, and we're looking for some ideas and recommendations on a go-forward basis, as we have been very much edified and very much supported by the great reduction in the cases and deaths that says this is not just a temporary dip, it seems to be sustained. And we want to make sure we're convinced of that before if we go open up again and then we have a big outbreak and somebody said, why did you not take more precautions? Because it's an area that's been hit heavily and we don't want to do that again. At the same time, we're very cognizant of the needs and emotional needs. That's why we wanted the essential caregivers back in and other ways to do that. So we're going to have some discussions on the matter and to see if we can move forward in some areas to make homes their homes.
Follow up, and this is the last question.
Thank you. And what about homebound seniors who can't travel to a vaccination center, who get different PSWs, coming into their home every day, so they are at risk? What about them? Because I'm talking to some families and they feel very left out of this and that they're being forgotten. I know that some areas, York Region, for example, paramedics are going into their homes, but it's not happening in Peel, for example. Is there any way to speed that up or offer some reassurance because people feel like they're being left behind?
Dr. Heyer.
Yeah, thanks, Cynthia. You're absolutely right that these are very important people and clearly are not forgotten. So there the challenge that we have with vaccine properties need to be overcome and need to be evaluated to ensure that we can effectively utilize all of the vaccine that's available within the confines of the property, and then to deliver it effectively into those that need it most importantly. So we have been having conversations with the home care delivery organizations, so the service providers, to both ensure that the providers are vaccinated and they are able to potentially go to locations as opposed to those who are in their homes. And then each of the public health units have been considering their own independent approach within their locale, because each unit has their own ways of responding and working through this. But it is something that we have not forgotten. It continues to be a conversation on a regular basis during the vaccine work that we're doing.
Thanks, everyone.